Okei, Akitäniko.
Nistoanikok, Susan Tallow-Christensen. I'm a physician in the community of Levern.
So tell us a bit about this COVID pandemic. We're over 100 active cases here in the Blood Reserve. We've just recorded another death, unfortunately. Prayers and blessings to the families. Tell us where we are with this pandemic and what is COVID-19?
COVID-19 is a virus, a new virus that has mutated and somehow miraculously found our vulnerabilities. It's kind of a brilliant virus. And my feeling is that we all have to, the only tools that we have to fight this virus is to come together and suffocate it out of our community. And the way that we do that is with vaccinations. Because people need to understand that, like, taking a vaccine is to protect others, and it helps with yourself as well. Because if all of us are vaccinated, then the virus can't spread among our community. And if the virus can't spread among our community, then it's not going to be here. You know, think about the last time you ever saw somebody with something like smallpox or measles. Those don't exist in our community anymore, and it's literally because of vaccination. So the vaccine to me should be like a tool that we had, a hatchet or a bow and arrow or anything like that. It helps protect us.
So there's a lot of myths and misconceptions out there, that I guess it alters DNA and it's a tracking device, nanotechnology. And as you say, we've always had vaccinations and they've worked. We don't have measles anymore. We don't have polio, etc. Right? So what do you think is driving this? I know it's a lot of social media, maybe peer pressure. But what are some of the things that you would like to say about these myths and misconceptions?
They're just ridiculous, and there's no question that they're untrue. I've never seen a single person who has even suggested that you get a microchip with an injection. I've never seen them ever produce a piece of medical evidence that shows that's true. And quite frankly, knowing as much as I know about science, I wish we were that brilliant to do something like that, but we're not there yet.
So now what is the new, like we got variants now, it's mutated. So tell us a bit about this variant.
Well, this particular variant can stay in the air longer than the old ones were. I think there was a study that showed it can stay in the air for up to 26 feet. So that's why wearing your mask is so important. You do not need as much of the virus to get into your respiratory system to get sick from it, and you will get a lot sicker if you do get this horrible variant. It is more deadly, especially to those who are really, really vulnerable. And the vaccine helps with variant infections, but it's not foolproof.
So the Blood Tribe is looking to get at least 80% mass immunization. We're somewhere just over 6,000 for the first dose and over 4,000 for the second. What can you tell the people to encourage them to go out and get their second dose and now third doses?
Well, one thing is, Browning has like 99% of their population vaccinated. Navajo Nation has over 90% of their population vaccinated. I mean, we're a competitive community. I mean, we should do at least that well. I mean, it's critical. And if you're gonna, a lot of people say I would die for my country. Well, take a jab for your community. I mean, honestly, I've had 2 doses myself, nothing happened. We've got a whole bunch of people in long-term care. None of them had bad outcomes from the vaccine. It is powerful medicine, and it is so life-threatening, and all you have to do is really look at the data. You can look at those who are dying of this particular virus who are unvaccinated versus those who have been vaccinated, and it is really strong, and it's even more effective than the flu vaccine, which we've had around forever.
So tell us a bit about the third booster shot. Who's eligible for this?
Well, right now, all Indigenous people over the age of 65 are eligible for it, so go out and get it, absolutely. And those who are immunocompromised, like people who have had transplants and they're on strong medicine to keep the organ from rejecting them, or if they're on medicine for rheumatoid arthritis that makes their immune system not work so strong, or if they're dialysis patients, or if they're patients who have cancer and they're on chemotherapy. All these things that limit your body's ability to fight infection.
Is there benefit for a move to include diabetics as well?
That'll be the next stage for sure, absolutely, because people with diabetes just do not fight infection as well, or people who have, are overweight, people with high blood pressure, but that'll be the next stage.
Okay.
I mean, I wish we were there now, because I would like everybody to get their boosters, including myself, healthcare professionals. I mean, I'm set and ready for it, but they have to. We only have so much vaccine, so they have to do this in stages.
So there's a new pulse oximeter being offered. Tell us a bit about the pulse oximeter.
Oh, it's one of my favorite tools. I've got one in my backpack. I've got like 4 here. It's so cheap. It's so easy. All you do is put your little finger in it and it lights up and it tells you what your oxygen level is. So my patients who have had COVID and they are recovering at home, I advise them, and I actually make it available for them to pick up and borrow from me so they can monitor their pulse oximetry at home. If a normal pulse oximetry is somewhere between 96 and 100%, and that tells you what your oxygen levels are in your blood. People with COVID can feel comfortable and their oxygen levels are in the 80s, and then they crash fast. So if your oxygen level at home and you go, whoa, it's 88%, I would tell that person, you go to the emergency room, you give your doctor a call, you call EMS, because you could have an impending exacerbation of your infection and deteriorate fast. So being able to monitor your vital signs, and oximetry is one of them, and it's cheap and it's easy to do at home. People should have them. It also tells you what your pulse is, your heart rate.
Any last comments and encouragement for Blood Tribe members to get their vaccination?
I would just plead with you to get your vaccine. It's so important for all of us. It is really our only tool to come out of this nightmare that we're all living in. And you really have to, use the elders who have had the 2 vaccines and the boosters as your role models. I mean, we should be going to them anyway. They're leading the way, and it is safe. I just haven't seen any horrible outcomes from this vaccine, but I've seen it save a lot of lives.